Perhaps the most stressful time patients go through in the midst of a cycle of assisted reproduction is the time between embryo transfer and the day when the blood test for the pregnancy hormone is taken. In fact, this has been nicknamed the 2-week wait. Many things go through patients' minds during this period: fear, hope, and uncertainty. Sometimes, certain circumstances that are typical of this waiting period crop up and increase stress levels. One of these is vaginal bleeding, either in the days leading up to the pregnancy test or after having a positive result, but prior to the first ultrasound scan, when correct development of the pregnancy can be confirmed. It is estimated that around 30% of patients may experience this dreaded bleeding. In the earliest cases, it usually happens 2 or 3 days before the pregnancy test, and often on the same day. Bleeding tends to be slight or very slight, and duration varies, but it is frequently self-limiting and usually not painful. When this happens, patients immediately tend to think all is lost. It is very important to highlight that at this point in the process, it is impossible to know what will happen. But bleeding of this kind is often linked to embryo implantation in the uterus, because the links between the two are established through the generation of microscopic blood vessels that the embryo releases and burrows into the endometrium. This microscopic invasion can lead to small maternal blood vessels being broken and the resulting vaginal bleeding. On other occasions, bleeding can mean that implantation has not taken place and the endometrium is beginning to shed and bleed. First of all, and we will not tire of repeating this, do not stop taking the medication prescribed by your doctor. Only the results of the pregnancy test will give us the final answer. We cannot be certain of anything until then, but at the same time, not all is lost. Secondly, get in touch with the clinic that carried out your treatment. They will provide specific recommendations for each particular case. If a patient bleeds after a positive pregnancy test, but before the ultrasound scan, bleeding can vary to a much greater degree in terms of quantity, appearance, duration, and whether or not the patient experiences any pain. During this time, and up until the point when fetal development can be observed using an ultrasound scan, we carry out beta-HCG levels. We know that keeping calm is complicated for the patient going through this, and that is completely understandable. However, patients must at least try to relax and follow doctor's instructions. The doctor will always be there to answer any doubts or questions.